Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about which medical coding certification is preferred by employers. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got an email from a viewer and I'm going to read it here in a minute. But I think that I need to say something first about medical coding credentials. People are under the misconception that having certain medical coding credentials will make you more money, okay? First of all, we don't talk about money in specifics on my channel, all right? That is a hard and fast rule. That is the rule that will be here forever, okay? But I want you guys to know that it's not about the credential that you have. A few things go into what you will get paid. Of course, experience is number one. And what are you doing in specifics, right? What specifically are you doing? What setting are you working in? What type of facility are you working for? Is this a government hospital? Is it a private hospital? Is it a public, community hospital? Which one is it? So that has a lot to do with what you will get paid. Private, nonprofit, for-profit, all of those factors come into play, which again is why I don't talk about money and specifics on my channel. I'm not here to sell the field of medical coding to you. I am here to help you to understand what all these other people that are trying to sell the field are not explaining. So I'm going to talk a little bit about these credentials and what they mean and what it actually means when you have them. But I'm going to read today's email that inspired today's episode. So here we go. All right. She says, "Good morning, Miss Blue," and spelled my name incorrectly. Guys, watch the details. My name is B-L-E-U, not B-L-U-E, B-L-E-U. And yes, while I know that sometimes, proofreading will help with this, and I know that sometimes it just changes it automatically, you guys can proofread. It's all about looking at those details. Being a medical coder is details, all right? So I have been watching your videos on YouTube on coding, and they're very informative. Thank you very much. If you have the time, may I ask your advice on what coding credential might work for me? I am an RN doing QA, and I think that means quality assurance, for home health for right now. I'm interested in starting a career in coding to concentrate on working remotely in the future. I do not have any other coding experience other than what I do now in my job as a RN QA for home health. Would a CPC give me a decent pay rate being an RN, or do I need to aim for the CCS, which I've heard is harder, and I am worried as I do not have any experience in outpatient or inpatient coding. Thank you very much for your help. See, here's the thing, guys. This is somebody that doesn't understand what these credentials are. Every medical coding certification exam is difficult. Now, the CCS is the mastery. So yes, that exam is more advanced than the CPC, but the CPC only covers outpatient coding. And that can be difficult for anybody. I mean, doesn't matter what your educational background is. I've heard of nurses failing the CPC before. But the CPC is all outpatient. It is the Certified Professional Coder. That is a flagship credential from the American Academy of Professional Coders. And this tests you on your knowledge for the outpatient setting. And it will go over all of the chapters in the CPT manual. There are very few questions about specifically on diagnosis coding, although the diagnoses are part of the multiple choice answers for all of the procedures, right? If they have procedure questions. But it tests on quite a few things. You can check out the domains on the AAPC website for the CPC exam. But I will say that the CCS is the gold standard of medical coding credentials. Now, this says that you have mastered not just inpatient coding, but the outpatient side as well. So you will have to know how to use the ICD-10 PCS manual as well as the CPT manual. And when you have done both of those, a lot of times people still struggle with the CCS exam because they don't realize how advanced it actually is. Sometimes people take this for granted and think, oh, well, I can try to pass it. It's not something that you can try to pass. With AHIMA, the American Health Information Management Association, who has that CCS, the Certified Coding Specialist exam, they are the ones that that make this exam and everything, but they always say this exam is about understanding. It's not about, hey, if you study this book, if you memorize this book, you'll pass this test. That is not the way to study for that exam, for the CCS exam. So it's important to understand what the difference is, where you are, and what you're doing for, whatever job you're trying to apply for. It's not about the credential or credentials that you hold. It is about your background, your experience, and your knowledge. When you go in and you take these assessment tests, they're going to assess your knowledge base and what you know. And they're going to do this because they're not going to hire somebody who's not competent enough to do the work. Obviously, being a nurse does not mean that it's going to be easy for you at all to begin with. There's a lot of nurses who are under that misconception because they think that they already do coding when they're circling from a super bill. And that's just not the case. Medical coders have to read and comprehend the documentation in order to get the codes selected or to audit and make sure that the codes that were selected are actually correct. Because sometimes a provider can actually do the code selections thanks to the EMR, but it doesn't necessarily mean that those codes that are selected are correct. So that's the thing. But get off of that thought process of, if I get this one, I'm going to make more money, or if I get this one, I'm going to make more money. Nurses tend to do well going into medical coding because they have their knowledge of being a nurse. And so they can spot things, that are missing from the documentation, whereas somebody who is just your regular medical coder that's come out of medical coding school but never went to like nursing school, they may miss certain things because they don't have that clinical background yet. But I've also seen nurses struggle with taking that nurse hat off and seeing that, okay, there's all these clinical indicators, so I can go ahead and pick this up. When in actuality, if you're looking at it from the medical coding standpoint, that you're going to notice that there's not sufficient enough documentation to support the selection of that code or that procedure. So that would have to be returned to the provider for a query or, for whatever else. So that's the thing where sometimes nurses kind of get into that. But I will always recommend that when you're getting into this, to really understand what these credentials stand for. The CCS means that you have mastered both inpatient and outpatient. This means you do not need any other medical coding certification. The CCSP, the CCA, obviously, if you have the CCA, which is a Certified Coding Associate, and that is the entry-level credential, medical coding certification. If you get the CCSP, which is the mastery of the outpatient setting only, that CCA will dissolve, because that is what AHIMA's rules are. When you get a credential that outranks that CCA, which is a CCS, or the CCSP, that CCA does get dissolved because it is considered the entry-level credential. Now, again, nothing wrong with it. I had it for 13 years. It was a very good credential for me, and I changed a lot of hearts and minds when I had it. So that is something that you need to know if you're getting into this. CCA does say that you are competent to understand and know what inpatient and outpatient coding is. It is a very rigorous exam to pass as well. So really, it depends on where you want to start. The CCA is a shorter exam. It is only 2 hours, but it does pack a punch. And it does say that you have enough knowledge to code for inpatient or outpatient. And then the recommended time is to spend 2 years with it. And then during this time to study for that CCS exam and then move on to the CCS. Some people bypass the CCA and go straight for the CCS. So a lot of people fail, but some people do pass. So it really all depends on your study habits, your ability to grasp the material, and what program did you go through. And some people will train themselves and they will still be able to pass. So it's really on the individual. People will ask me, what do I recommend? I say you can start off with any of these. It just depends on the mindset that you have. If you have the CCA or the CCS, this means that you can apply for inpatient positions or outpatient positions. So you have a lot more places to apply for. If you have the CCSP, which is a Certified Coding Specialist physician-based, the mastery of the outpatient setting certification through AHIMA, the American Health Information Management Association. If you have that, or if you have the CPC, the Certified Professional Coder through AAPC, This means that you can apply for outpatient positions. Now, there's plenty of outpatient positions out there, so it's not like, well, I have to get the one that does both. If CPT was easier for you, the outpatient setting is easier for you, then obviously you want to go with taking either the CCSP or the CPC. You don't need them both because they both will say the same thing. Now, I've done the cost analysis for, what it costs to maintain an AAPC certification versus maintaining a AHIMA certification. There's a huge cost difference between the two. Again, which is why I say you do not need both. You only need one certification to start off with. And I don't care if you're a nurse, you still only need one to start off with. You don't need to collect a bunch of credentials because it's just more money going out. I never encourage more money going out. Why? Because when you look in these job listings, you don't see them asking for multiple credentials from the medical coders. They just want you to have one. And that's all you need to get started with. Now, when you've had experience and you go on later on and you say, hey, I want to do CDI, clinical documentation integrity, and I want to get the CCDS or the CCDSO, that is fine because that is something completely different from medical coding, and that's more specialized in what you want to get into. There's a few others with AHIMA that they like the certified health data analyst, right? So there's other ones that you can venture off into if you want to do that. But really get the experience first before you start racking up all these credentials. It's not impressive to see a bunch of credentials, especially when they say the same thing. If I see somebody who has the CPC and then I also see them have the CPB, well, I know that CPC already tested them on reimbursement. Why are you getting a certification that says that you can do billing, certified professional biller? What's the sense in that? There's no employer asking for that either, okay? CRC, same thing with the risk adjustment. Risk adjustment, that's diagnosis coding. Again, something that is tested on that CPC exam. So, it's up to you guys what you want to do. Some people will try to rack up a bunch of credentials because they think it'll get them hired faster, and it will not. It just depends on how you're presenting yourself to the potential employers and your knowledge base. All you need is one medical coding certification to start with, okay? So that is something to keep in mind. Now, yes, there are different things that you can do once you've been in the field and you start to understand like, okay, well, I have a special interest in doing clinical documentation improvement. That's another thing that, you would want to get certified in that because that says that you've had that kind of training and that you have that knowledge and you have the competence to be able to do that. But really kind of look at what you're going to enjoy in your time. Because when you start enjoying what you're doing at work, you're going to produce better results. When you focus on the money, that's not going to set you up for success. Because if you're so always focused on the money, you're going to be miserable. At least that's just my advice anyway. We get one rodeo in life. And if you don't enjoy what you're doing, you will make everybody around you miserable. And I've seen so many people that don't like what they do and they make everybody miserable. And that's unfair. When you think that you get through 20, 30 years in a career and you've spent all that time purposefully being miserable because you didn't like what you did because you're chasing it for the money, rather than looking at your career as something like, this is something that I could potentially enjoy. I enjoy my career. I don't even work anymore in my mind. Even though I work 40 hours a week, it's not work to me because I enjoy it so much. And is there chore things that I have to do? Of course, that's the reality of any working life. But for the most part, I don't work. It's just a joy to me to be there and to do what I do and to be able to educate my providers and to make myself a better medical coder and share all of this information with you all. So for me, I know that I don't have to wait until I'm retired to be happy with what I'm doing. I'm happy now. And for me, that gives me so much freedom, and that gives me a lot of joy to be able to say that. Because I know there's a lot of people that will never get to that in their career. They will probably get to that when they retire, but even then, sometimes they don't even get to that feeling of feeling fulfilled in something that they're doing career-wise. So, guys, it's entirely up to you Don't make it harder on yourselves. If you want to start off with the CPC, don't start off with the CPC because you think it's easier. Trust me, I've seen many nurses fail the CPC as well. They get those nerves and things like that. So sometimes it's not about the material that messes the person up when they're taking the exam. It is themselves. And I've done many shows about, being prepared for the exam, being prepared for all of these things. And it's really up to you. But don't look at it like that just because you think that it's an easier exam, because trust me, people have failed it just as equally. You can look at the CCSP, because that is just outpatient coding. So you can look at that because it's AHIMA's version of outpatient testing only, and it covers the CPT manual. It is a very worthwhile credential as well. So you can take that, and you don't have to pay the $190 every single year that you have to have that CPC, because AAPC does require you to be a member every single year that you have their certifications. You have to pay $190, and then if it goes up, it goes up. But currently the membership rate is $190, and you have to pay that every single year that you have your credential. If you do not, they will revoke your credential. With AHIMA, you do have to pay a maintenance fee every 2 years if you are not a member. And that is okay, because you have to pay that in order to report your CEUs, which maintain your certification. And with AHIMA, you need 20 for one certification. With AAPC, you need 36 continuing education units for one certification. So I want you to keep that in mind. If you're out there and you're thinking, which one should I go for? And, which test is easier? None of these tests are easy, because they are meant to test competence, and they are meant to test, your knowledge and your ability to be able to recall in whatever setting that they're testing you for. So remember, the CCA and the CCS both are covering inpatient and outpatient medical coding. So those exams are going to cover the ICD-10 CM manual, the CPT manual, and the ICD-10 PCS manual as well. The CCSP and the CPC are both going to cover the ICD-10 CM manual, the CPT manual, and the HCPCS Level 2 manual. So again, if you are more comfortable with those in the outpatient setting, because those CPT codes are already made and you don't have to create those like you do with the PCS manual, then maybe that's an option for you. So if you only want to take the outpatient test, AHIMA has their option with the CCSP. And again, it's a very good credential. And that's what I have to say about that. But yes, so don't think about these exams as well. This credential is going to pay me more, or I'm going to get more money with this one. It's not about that. It's about your knowledge. Okay. And so every place pays differently. And that's another thing that you got to keep in mind. And wherever you start at does not mean that that's the pay rate that you're going to stay at. Okay. So that is something else that you got to make sure that you understand. People will say, well, I don't want to get paid this because this school said that I can make this amount of money. And when you look at the amount of money that they're saying that you can make, it always says up to. And what makes me mad is that that's for veteran coders. That's not for brand new medical coders. But they sell the field based on that. They sell the field based on you can make up to. And people are not listening to anything else after that. They're looking at that number. That's the number they see. That's the number they want. And that's the number that they try to get when they go out. And then they're shocked when they can't get it. And this is why I say you have to have realistic expectations. No, you're not going to make $12 an hour, but you are going to start off at a decent salary. So that's the thing that you have to know. And how do you find out what is fair for your area? You can go to the Department of Labor or the Bureau of Statistics, and they do have what medical coders start off at in that region. So because again, every region is going to be different. So I want you guys to know that. And please don't send me specific questions about money, because I do not talk about money on my channel, and I do not talk about money in emails either, okay? So I want you guys to know that I will not answer those questions, because again, it is going to be different everywhere, and my channel is not for that. My channel is to help you to be a better medical coder, to know what to expect, how to communicate with these providers, because all of these things are very important to being a very good, high caliber, well-rounded medical coder. At least that's just my opinion anyway. So I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, I hope that you will share it, like, subscribe, and I will see y'all next time. Bye.